AURA3 was a randomized study comparing osimertinib versus standard platinum pemetrexed chemotherapy in patients that had progressed on first-line EGFR tyrosine kinase inhibitors and had T790M centrally confirmed in their tumor, demonstrated superiority of osimertinib in that setting. And the focus of the study was plasma ctDNA-based study of mechanisms of acquired resistance to osimertinib. The main findings from this study included loss of T790M in about half of the patients, and the most common alternative or competing mechanisms of resistance were MET amplification in about 19% of the cases, and EGFR alternative mutations in 21% of the cases, out of which 14% were C797S. There were a number of other alterations. The field is very complicated, and those included alternative gene amplifications such as PI3 kinase amplification or cell cycle gene alterations. Several gene fusions were detected, BRAF V600E mutations, and in many cases there were overlapping alterations. Therefore, I think the main message from this study is that one cannot assume a uniform mechanism of resistance for patients exposed to osimertinib in the second-line setting. A similar message came out of the FLORA acquired resistance study, in that the mechanisms were also diverse. Of course, there is no T790M loss in that setting, since the patients start out with sensitizing mutations in the FLORA study. But interestingly, the other alterations, MET amplification and alternative EGFR mutations, were also present in the FLORA study. There was enrichment for these mechanisms in the second-line setting. The percent of alterations in the front line was less than we saw in the second-line study, but similar mechanisms of resistance. This directs, in some way, our research in the future, how we should address the different groups of patients harboring resistance mechanisms that are quite diverse. There are drugs available for MET amplification, which is the most common mechanism seen otherwise. Clinical trials either addressing resistance or trying to prevent resistance from occurring are ongoing, and we expect results from these studies. For C797S, there are no clinical data describing drugs that could potentially address this mechanism. In my presentation, I focused on the fact that C797S occurs in cis position compared to T790M, and that would predict for resistance to all three generations of EGFR TKIs.